Hi, my name is Camila Ramirez, and I'm going to do my health assessment practical exam. First, I'm going to perform hand hygiene by washing my hands with soap and warm water, rubbing my hands vigorously for at least 30 seconds. I will then close the curtain for patient privacy. Now I'm going to introduce myself to the patient. Hi, my name is Camila. I'm going to be your student nurse for the day. What's your name?
Alana.
And where are you?
The hospital.
And what year is it?
2020.
Thank you. Based on this, I can tell that my patient is alert, awake, and oriented times 3. That is to person, place, and time. Now, I'm going to ask my patient to squeeze both of my hands. Thank you. Based on this and the previous questions, I can use the Glasgow Coma Scale to assess her consciousness. She scores a 4 for the eyes portion because her eyes opened spontaneously when I walked into the room. She scores a 5 for the verbal portion because she answered my questions appropriately and is oriented. And she scores a 6 for the motor portion because she was able to follow my verbal command. This gives her a score of 15, which is the highest score you can score on the Glasgow Coma Scale, and 3 is the lowest. Now I will ask her a couple of questions. Do you have any allergies?
No.
Do you take any prescription medications?
No.
Do you take any over-the-counter or herbal supplements?
No.
And is there any past medical history that you would like me to know about?
No.
Okay, and what brings you in today?
I had a seizure.
Do you have a history of epilepsy or have you had a seizure in the past?
No.
And was your seizure witnessed?
No.
So in the case that her seizure was witnessed, I would ask her the following questions, such as, what was the duration of the seizure? Did she endure any head injury? Or did she lose any bladder or bowel continence? Now, Alana, did you hear, see, or smell anything strange prior to your seizure?
No.
Okay. Now I'm going to go ahead and take my patient's vital signs. First, I will take her oral temperature using a thermometer under her tongue. A normal finding would be 96.4 to 99.1 degrees Fahrenheit. I'm going to take her heart rate. I'm going to measure her radial pulse for a full minute, 60 seconds, using these 2 fingers, not my thumb because it has its own pulse. I'm going to count for 60 seconds to account for any irregularities in rhythm. After, I'm going to pretend to continue taking her heart rate and place her own arm, a normal range would be 60 to 100 beats per minute for a heart rate. I'm going to place her arm over her chest to pretend that I'm still taking her heart rate, but in reality, I'm taking her respiratory rate. 1 inhalation and 1 exhalation is considered 1 full respiration, 1 breath. A normal range would be 12 to 20 breaths per minute, and I would count this for 60 seconds. Now I'm going to take her blood pressure using the 2-step method. I will take the blood pressure cuff, wrap it around her arm, align the arrow with her brachial artery. I'm going to estimate her systolic blood pressure by measuring her radial pulse and inflating the cuff. When I can no longer feel her radial pulse, that is a number that I estimate as her systolic blood pressure. I'm going to deflate the cuff, let her arm relax for approximately 1 minute. Now, with my stethoscope, I will place the diaphragm over her brachial artery. I'm going to re-inflate the cuff, this time 20 to 30 millimeters of mercury above the estimated systolic pressure that I previously recorded. So now I will inflate, and with my stethoscope, I have it over her brachial artery. I'm going to deflate slowly. The first sound that I hear is her systolic blood pressure. The last sound that I hear is her diastolic blood pressure. A normal range for blood pressure is 90 over 60 to 120 over 80. Now I'm going to assess her oxygen saturation using a pulse oximeter. I will place that on her finger, and a normal finding would be 95% and above. I will also assess her pain. I will ask her on a scale from 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever had, can you rate your pain?
0.
Great. Now I will go ahead and assess my patient's circulation. First, I will inspect the color of her skin, and I note that it is congruent with her ethnicity. Now I'm going to assess her capillary refill, taking 1 of her fingers. I'm going to press on the fingertip and nail that. I'm going to allow it to blanch, and I'm going to let go. After it blanches, the blood should refill in less than 2 seconds. And now, with the dorsal part of my hand, I will feel that her skin is warm and dry. Now, I will assess my patient's pulses. I will use a scale from 0 to 3 plus, 0 being no pulse, in which I would need a medical provider to confirm that. 1 plus is a weak and thready pulse, 2 plus is a normal pulse, and 3 plus is a bounding pulse. Now, I'm going to start with her temporal pulse. So for the pulses, you would typically count it for 60 seconds, but for this purpose, I'm not going to. And you can take it on both sides. Temporal pulse on the temple, carotid pulse. And for the carotid pulse, it's important not to take both at the same time because you don't want to occlude blood to the brain. After the carotid, we would take the apical pulse. In this case, I will not perform it on her, but it's right above the apex of the heart. Then the brachial pulse, which is on the medial part of her elbow. The radial pulse on the thumb side of her wrist. The femoral pulse, which I will not perform on her, is in between the groin and the leg. And the popliteal pulse is behind the knee. The posterior tibialis pulse is on the medial part of the ankle, behind the medial malleolus. And the dorsalis pedis pulse is on top of the foot. Now, I will assess my patient's thyroid gland. I will first let the patient know that I'm going to be assessing her thyroid gland, and I will be reaching from behind to touch her neck. Is it okay if I proceed? Okay, thank you. I will also hand her a glass of water so that she can swallow, and I will be able to feel that as well. So from behind, I will use one hand to displace and one hand to feel. So on either side of her trachea, I will displace with one hand and feel with the other. I will ask her to now take a sip of water. Okay, and the normal expectation is to feel nothing. I will also note that the right side of her thyroid gland is slightly larger than the left side, which is absolutely normal. Now, I'm going to assess my patient's lymph nodes. For the lymph nodes, we expect them to be small, movable, and non-tender and rubbery. What we do not want is for them to be hard, fixed, and painful. I'm going to start with the pre-auricular lymph nodes, which is in front of the ear, post-auricular lymph nodes behind the ear, occipital lymph nodes, which is by the hairline in the back, submental lymph nodes under the chin, submandibular lymph nodes under the mandible, jugulo-digastric lymph node, which is below the earlobe, superficial cervical lymph nodes, which is alongside the trachea, the deep cervical lymph node. I'm going to ask her to tilt her head towards the left so that I can feel for the left deep cervical lymph node, which is deep to the superior one. And for the posterior cervical lymph node, that is behind, it's alongside the spine. And for the supraclavicular lymph node, I'm going to ask my patient to shrug her shoulders, and I'm going to feel that lymph node above the clavicle. For the axillary lymph node, that's going to be in the armpit region, which I'm not going to do on her. And for the epitrochlear lymph node, it's going to be above and below the crease of the elbow, and the inguinal lymph node that I will not be performing on her is going to be in the region between the groin and the leg. Now for the cranial nerves. The first cranial nerve is the olfactory nerve, which is a sensory nerve. I'm going to assess this by asking my patient to occlude one nostril and breathe in, and do the same on the other side. This is checking for patency to see that she has airflow and will be able to snap. I will now ask her to close her eyes, and I will ask her to occlude one nostril. I'm going to pass a familiar smell underneath her nose and ask her to identify the smell. Cinnamon. And she will do the same on the other side, this time with a different scent. For the cranial nerve number 2, the optic nerve, which is also a sensory nerve, I'm going to perform the confrontation test. So I'm going to ask my patient to stand up and face me. I'm going to ask her to cover her left eye. I will cover my right eye. And I'm going to have my hand in 4 different angles. I'm going to wiggle my fingers, and she will tell me when she sees me wiggling my fingers. Now. 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 Great. And I will perform this on both sides. Now for cranial nerves 3, 4, and 6, which are the ocular motor, trochlear, and abducens nerves. These are all motor nerves. I will be using the Perla test. I expect her pupils to be equal, round, reactive to light, and will accommodate. So I will first have my patient look into the distance so that her pupils can dilate. With my pen light, I will shine her right eye, and I expect her right pupil to directly constrict. I will then again shine her right eye and expect her left pupil to concentrically constrict. Now I will shine her left eye and expect the left eye to directly constrict, and I will shine the left eye once again and expect the right pupil to concentrally constrict. Now I will allow her to look into the distance so that her pupils can dilate once again. Now I will ask her to look at the tip of my pen light. I'm going to bring the pen light closer to her. I expect her pupils to converge and to constrict, which they did. Now, I will assess her fifth cranial nerve, which is the trigeminal nerve. This is both a sensory and motor nerve. Can you have a seat, please? And I'm going to use my cotton wisp, and I will touch her face in 3 different locations. And I will ask her to close her eyes, and I will touch her face in 3 different locations again, and she will identify, point to where I touched. Great. Now I will assess her seventh cranial nerve, which is the facial nerve. This is both a sensory and motor nerve. I'm going to ask her to puff her cheeks, smile, and frown. I'm looking for symmetry. Now for the eighth cranial nerve, the vestibulocochlear nerve, or the acoustic nerve, which is a sensory nerve, I'm going to perform the whisper test. So I'm going to step behind my patient. I'm going to ask her to occlude one ear by pressing on her tragus. And I'm going to whisper 3 2-syllable words. Paper, table, orange. Great. And she would do this on either side, on both sides. Now, for the 9th and 10th cranial nerves, which are the glossopharyngeal and the vagus nerve, these are both sensory and motor nerves. I'm going to perform the, I'm going to take my pen light and my tongue depressor. I'm going to depress her tongue and ask her to say ah. I expect her soft palate to rise and her uvula to be midline. For the 11th cranial nerve, which is the spinal accessory nerve, a motor nerve, I'm going to ask the patient to shrug her shoulders, turn her head to the right, and to the left. Now I will ask her to do the same movement, this time with a little bit of resistance. So please shrug your shoulders, turn your head to the right, and out to the left. Great. And finally, the 12th cranial nerve, which is the hypoglossal nerve, a motor nerve. I will ask my patient to stick out her tongue. And I am looking that there is no twitching of the tongue, which would be an abnormal finding. Okay? Now, for the cerebellar functions, I'm going to do 2 tests for her motor cerebellar function, so please stand up. I'm going to have her perform the Romberg test. So please put your feet together, arms alongside, and she's going to close her eyes. I'm going to have my hands in front and behind her in case she falls, which I don't want. An abnormal finding would be ataxia or any severe imbalance. A little bit of swaying is normal. Thank you. And now we will perform the finger to nose test. So you can face me. Place your finger on your nose. Now touch my finger on your nose, my finger, your nose, my finger. Thank you. And now for sensory cerebellar function. I will do the sharp and dull test. So I will take my tongue depressor, split it in half. Now I have one dull end and the sharp end. I will take her arm, let her feel what the dull end feels like and the sharp end feels like. I'm going to have her close her eyes now, and she will identify which is sharp or dull. Sharp, sharp, dull, sharp. Okay? And now for the kinesthesia test, I'm going to take her hand, and I will show her what moving her finger up and moving her finger down looks like. I will have her close her eyes, and I will do the same, and she will identify if I am moving her finger up or down. Up, up, down, up. Great. And now for the stereognosis test. I'm going to place a familiar item in her hand. I'm going to have her close her eyes, and she's going to identify the item. Identify this item. A key. Great. Now I will perform the graphesthesia test. With my patient's eyes closed, I'm going to draw a letter in the palm of her hand, and she will identify what the letter is. B. Great. Now for deep tendon reflexes. I'm going to assess my patient's brachioradialis deep tendon reflex. I will hold her arm in my arm. I'm going to palpate for the brachioradialis tendon, and with my reflex hammer, I will only use the pointy side above the waist and the flat side below the waist. So with the pointy side, I will straighten my own thumb, and I expect the hand to supinate. Now for the triceps reflex, I'm going to hold her arm in my hand. I'm going to stand behind her because the expectation is for her arm to extend. I will strike the triceps tendon with the pointy side of the hammer, and I expect a slight extension of the arm. For the biceps reflex, I will hold her arm in my hand, palpate the brachial tendon, strike it with the pointy side on top of my thumb, and I expect a flexion of the biceps. For the patellar deep tendon reflex, I will have her take a seat. Please place one knee over the other. I want her foot to be dangling. And with the hammer, now with the flat edge, I'm going to palpate the patellar tendon and strike it. And I expect a slight extension of the leg. And I'm now going to have you kneel. I want the Achilles tendon to be relaxed. I will, with the dull end, strike the Achilles tendon. And I expect plantar flexion. Okay. And for the last one, you can have a seat. I won't actually perform it on her foot, but if this were the patient's foot, I would draw an upside down J from the lateral side over the toes. And a normal finding in an adult would be curling of the toes or nothing. An abnormal finding would be the spanning or the fanning of the toes. That would be a positive Lipinski test, which is abnormal in adults but normal in babies who haven't walked yet. Thank you.